Good afternoon, everybody. I'm Rick Luftglass, Executive Director of the Lori M. Tisch Illumination Fund. We're really glad you're here, and I think you're in for a very exciting and interesting conversation. Those of you who might have been here last year might have heard then Surgeon General Vivek Murthy talk about mental health as the defining public health crisis of our time. And he talked both about youth and adolescents and also adults. And we saw mental health issues explode during COVID, but they existed before, and they've continued, particularly among marginalized communities, low resource communities, and others. What we are going to be talking about today is some perhaps unconventional approaches to addressing issues of mental health through sports, the arts, and nature. And not instead of therapy, but really to augment or make connections or help produce protective factors. So that's what we'll be hearing about today. So let's hear some introductions. Allison.
Thank you, Rick. I'm Allison Neiman, and I am the CEO of Mindful Philanthropy. Thanks for being here today.
Hi, everyone. My name is CJ Golding, and I am the co-founder and executive director of Boys in the Wood.
And hi, everyone. My name is Vanessa Garcia Brito, and I'm Nike's Chief Impact Officer.
Allison from Mindful Philanthropy is going to give us a bit of lay the context of some of the issues and trends in mental health philanthropy, but not just as it relates to sort of foundations and corporations, but many of you are very philanthropic, and we hope that you find something that interests you here as well.
Thanks, Rick. Rick mentioned that the Surgeon General, Dr. Murthy, has said that mental health is the defining issue of our lifetime. And we know that a Lancet study has showed that over half of the world's population will have a mental health condition by the age of 75. So we know that it affects every family, every community, and is holistically affecting our society. The economic burden, when we think about this, is, there are various studies that are out there from Deloitte to Michigan, at the University of Michigan, but it points to anywhere from over 250 billion to over 450 billion in economic burden of mental illness and mental health inequities on our society annually. And they project, actually, that by 2040, this will be up to 14 trillion. So this is an issue that not only do we think about from a personal lens of each one of us, but we have to think about it because it's about our economy, it's about our workforce, it's about livelihoods, and it's about thriving and flourishing. So at Mindful Philanthropy, just to give you a little bit about us, we were formed in 2019 with a study out of the Center for High Impact Philanthropy that showed that there was 1.3% of foundation funding going to mental health, addiction, and well-being. We repeated that study last year and found that that has increased to 1.7%. Marginal increase, so we're doing a good job. We're going in the right direction, but that actually is just keeping pace with inflation. And so our mission is to increase the funding to mental health, addiction, and well-being through convening philanthropy, putting them in the room with the researchers and the experts, reducing the silos, helping them to see what can be scaled, what are the interventions. We also guide philanthropy through strategic guidance. We have over 19 publications and pieces of guidance that exist at the intersection of mental health and other issue areas such as women's mental health, youth mental health, and helping funders make strategic decisions around their dollars and where it can have the most impact. And we also uplift proven and promising opportunities, of which we're going to talk a little bit about today. But philanthropy has a really incredible role to play when we think about funding non-traditional interventions, and whether it's on a field, at a park, or through creativity, there can often be interventions that are not the traditional models. And arts and nature and sports are deeply human interventions. They're also non-stigmatized interventions, particularly for underserved communities. And so we're excited today to talk a little bit more about arts and sports and nature. We know that when people are engaged in arts, that it lowers their cortisol levels, it reduces stress and anxiety. When people are in nature, it improves attention, and it also lowers cortisol levels. And unfortunately, we know that 70% of underserved communities do not have access to green spaces. And that's unfortunate because of what we know the benefits to be, and especially for trauma-impacted youth that could really benefit from green spaces and nature. And then participation in sports, we know, is incredibly beneficial for producing grit, resilience, agency, but also creates that community aspect. So we're going to talk a little bit today about how arts and nature and sports, it helps the individual, but it also helps communities and societies, and is a system. It's a systems level intervention for thinking about how to go upstream, which is so important as we think about the role of philanthropy.
Thank you. CJ, can you talk about Boys in the Wood and why you created it, when you founded it, what it is, and what impact you're seeing?
Sure. I'll start with what it is. I think the name might be a little misleading for those of you who aren't familiar with the John Singleton 1991 film, but we primarily work with black men, 18 and up. And we use nature, as Allison was mentioning, we use nature as the vehicle for transformation for black men. We understand that there are stigmas and barriers relating to access for both nature and mental health for Black and African American communities. And our vision, our goal is an embodiment of what might be possible if Black men were resourced and healthy and had the agency and the ability to be able to not only participate in healing themselves, but then be active agents of healing in their communities. Our idea is that sometimes systems are not meant to serve everyone. Traditional therapy, for instance, is a system that, or an approach that may not necessarily fit every single culture, or may carry its own kinds of stigmas as well. And so what we're hoping to do is that we're hoping to provide something culturally relevant, something community rooted, something that the men we work with and their families can understand, and use it as a bridge and a stepping stone into these spaces and areas where we may have been separated from access. The innovation here is not to say that therapy is bad, but to change the singular narrative around therapy, to change the singular or separatist narrative around nature, and then to be able to give folks the pen to write a new narrative of what health and well-being looks like for themselves and their community. Our primary programming, or introductory programming, happens in 4-day, 3-night retreats where we bring black men together and they spend 40% of their time in outdoor recreation. So we're introducing them to new skills, new activities, reducing the barriers of cost, knowledge, awareness to gear and these spaces. And then 40% of the activity are workshops that are led by a black mental health, a black therapist. 4% of therapists are African American, and most African Americans are not able to access, about 29% are able to access care if and when they do need it. So imagine wanting to get help and not knowing where to find it. Imagine knowing you need a resource and not finding it on the shelves in the store when you go to look. So our hope is to be able to write a narrative, an inviting narrative that's rooted in community that allows people to be able to participate and be leaders in writing the rest of that story.
Thank you, CJ. Vanessa, I have been so struck by Nike's commitment to mental health, manifested through a number of programs and employee services. Can you talk about what Nike does, why, and then to dive into these specific programs?
Sure. Hi, everyone, again. So at Nike, we believe in the power of sport to move the world forward. And we believe that if you have a body, you're an athlete. Now, when I say that, a lot of people think about, maybe the sports that come to your mind are running. Okay, I'm biased. Maybe I'm the only one that thinks about running. Basketball or football. But maybe life is your sport, because life is sport. So hold on to that. That's a good thing. And also, when we talk about if you have a body, you're an athlete, a lot of people think about the physical aspects of that. But in reality, it's both the physical and mental aspects of that make an athlete. And so if you're an athlete in the sport of life, then great news, there's real potential within that. We believe that sport and moving your body can be a gateway to achieving your greatest potential. And we want to make that true for youth everywhere. We specifically focus on kids ages 7 through 17. But the reality is that we're up against some serious challenges. Only 1 in 5 kids around the world get the physical activity that they need. And yet we know that active kids are healthier, happier, more likely to do better in life and in school. Girls and underserved youth, they're moving the least. And most youth are also living through trauma and stress. That's especially true if they are living in areas of crisis or in unstable environments, whether that's at home or at school. We know that through the work that we do with the Center for Healing and Justice Through Sport, that causes brain dysregulation, meaning that a lot of our youth, and probably many adults, are on edge, very reactive, on high alert. And as you can imagine, that's pretty exhausting, not just physically, but also mentally. And play and sport is uniquely designed to help address that. Sport provides the consistency and reliability, structure that kids need to experience stress in doses that are manageable for them. We're not talking about removing stress completely from our lives. That's not realistic, but also not necessary, because there is a way to manage and process stress well. And movement, especially patterned, rhythmic, repetitive movement, helps your body to process toxins and stress that is held onto in your body. So that's one of the many reasons that we're focused in this area. It's true, it's important for us to start at home. So if you visited any one of our campuses, what you would be met with is many opportunities, whether that's from moving around the campus. We have several gyms and offerings, and it's pretty holistic, from either meditation and mental health awareness elements to nutrition and how you nurture and feed your body, and everything that you can imagine in between.
Great. Briefly, so in addition to moderating, I can share a little bit of information on the Laurie M. Tisch Illuminations Arts program, Arts and Health. And Laurie, fortunately, is in the office, not office, audience. And the and it actually was at Aspen and various other places where we started talking about arts and health and where those intersections happen. And then we spent a lot of time doing research on the field and what the gaps were. And we decided to, and this goes back to 2018, to focus on 3 primary areas: mental health, stigma, trauma, and aging-related diseases. And to use not just one artistic discipline, but music, dance, theater, storytelling, film. All of those have very distinct opportunities. Some of them affect youth, some of them are adults. So we kind of took this broad view. We now have about 30 grantees, all of whom are featured in a report you can get for free. We have some around, and you'll see the QR code. But a couple of examples, an organization called Community Access developed a filmmaking program called the Changing Minds Young Filmmakers Program, where young people, 15 to 25, submit films that deal with real mental health issues and combat stigma through personal stories. The first year we supported them, they had about 300 submissions. This year they had 1,600. That just gives you a sense of the need and the impact and the opportunity. So that's just one.
Well, and what I love about art and what you all have done is that it's such a powerful narrative change. It can shift public opinion. It can shift, the way that we perceive mental health. And you all have done such an enormous amount of work around that through, exhibits and things like that. And you've been a leader in the field. So thank you.
Thank you. It's a flourishing field. The WHO has been doing a lot of research, and the Jamil Lab. Aspen partnered with the Johns Hopkins International Arts and Minds Lab to create something called the NeuroArts Blueprint, which is essentially a collection of research, but then to actualize that and operationalize that to build the field of arts and health. So we're seeing so much momentum. Let's talk about the concept of intentionality. CJ and I started talking about this a while ago, recognizing that the arts are inherently therapeutic. Yes, absolutely. But what we found during the pandemic, for example, is we did an open call for arts organizations that wanted to address mental health. And so many of them said, you know, our programs are really good because people feel better. But what we saw was the strongest ones were ones where there was a therapeutic advisor, social worker, therapist who was working with the arts organizations and made it a very clear sort of intentional mental health intervention, not just to feel good. And CJ and I were talking about this in terms of nature.
Yeah, so as Allison mentioned, nature has, there's a plethora, a myriad of benefits that access to nature, being around nature, even the flowers on the table here in this room can provide. For those of you who spend time working in an office, I'm sure that you can tell the difference between having the plastic potted plant in the corner and offices that have a little bit more greenery or even access to green spaces. I have 10 years of experience in the outdoor recreation and connection to the nature fields. And one of the things that's often missing in that field is folks see nature as the finish line. They say if we can just get them into nature, they'll get all of these benefits and their problems will be solved. But there's a level of intentionality, not only in nature, but I practice it in nature, but it's practiced in everything that we do, where it's who is making the connection that matters. It's what the activity is that matters. It's the follow-up. It's this ecosystem of care and an intention in planning it that makes that possible. As one example, we partner with an organization in San Antonio called Black Outside. Their founder is sitting over there at the table in the beige hat, and their goal is to reconnect Black youth to nature. So they have programs they have a Camp Founder Girls program that works with young Black girls, and they have a program that works with young men. And it would be great to have a program that took young Black boys into nature. Some might call it a success and hope that they get all the benefits that research has said that nature provides. But there's a different level of intention, a different depth of healing when the mentors of that program believe and embody and practice what it means to heal in nature, what it means to live in a community, what it means to have brotherhood literally flowing through your veins. And so that group, they have a connection, they support each other, but we also partnered with them to bring some of the expertise and the tools that we have around mental health and ways to regulate and ways to write a positive future for mental health that layers, I call it stacking, but there's probably a research term for it, that stacks these levels of intention, that makes sure that that benefit is not quick and fleeting, but that it's long-lasting and it becomes a part of our culture, it becomes a part of our DNA, it actually becomes a new system to replace the one that we may have lived in before.
Thank you. Vanessa, I know a big part of programs like the Campaign for Sports Equity and other work that you're doing involves training of parents, coaches. Can you talk about that kind of intentionality, how you sort of do more than just, say, go out on the field and kick a ball around?
Sure. We're really proud of the work we're doing with the Coalition for Sport Equity. It's really trying to close the gap on sport equity and ensure that it's happening everywhere. But I think, most important, many important areas around it is we're often gathered here talking about how society is failing youth. And here we have a great example around where adults, committed adults, passionate adults, people who are willing to put in the time and their space are out there every single day showing up for young people, and more importantly, are coming together with their organizations, preserving the missions that they have, and joining a group to advocate for youth versus competing against each other for the few funds that are out there, right? So it really flips the scarcity mindset on its head to bring in more funding for everybody. The work is already happening across 18 states. There are over 500 organizations, I think it may be up to 700 organizations now, and they're serving 1.5 million kids. A great example of what that work can do is happening actually right in Los Angeles, where they've won $15 million for youth sports over the next 3 years from LA County. That's just one example. There's some great examples in Washington State. Chicago also provided some really significant funding for the fund. And so these organizations are pulling together. They're not duplicative, they're complementary. More importantly, they are providing their best assets and perspectives and experience and skills, et cetera. And literally doing what, we're often wondering, what does it look like when 1 + 1 = 5? Well, it looks like the Coalition for Sport Equity. Allison, I know you've been a part of that, and thank you for your support there. And something to really check out. Talk about intentionality. It requires diligence and consistency, also proximity. I think what's great about the Coalition for Sport Equity is that you can have the scale across the country, while those particular groups are very local. They are organized in cities based on what they know best, and they know their neighborhoods and those kids best.
And speaking of local, so New York and New Jersey, Gotham FC, which is the women's sports team, has launched a partnership with initially the Laureum Tissue Illumination Fund, but now Dove, around both body positivity, but also the dropout factors of why girls drop out of sports, typically 12 to 14 age. And I know you've been working with Dove as well, which is really great.
Yeah, and I think it goes back to your question of intentionality. Right? We've been doing this work for decades, and what we know is that girls fall out of sports, but not just at any time in their lives. They fall out right around when they're 6 or 7, when they're going into schools, right, and just not finding the activities are for them or fun, or it's just really actually stressful for a lot of young girls. And then again around the ages of 11 and 12, when their bodies start to change and they're becoming adolescent girls. And so together with the work that we did with Dove and a couple of other partners and experts, we got really specific about the why. What is causing this to happen? And it's body confidence, right? One, we know that all kids, not just girls, but all kids need coaches that look like them, that understand them, that they can relate to. I think you were talking a little bit about that, CJ, in your work as well. That's especially important for an 11-year-old, 12-year-old girl who's going through change. She wants her coach to talk to her about her changes in her body and why she can still play sport. There are a lot of myths out there that need to be debunked, and I think the research goes a long way in doing that. And there is a way to speak to her, to recruit coaches, to help equip them with those resources as well. But it didn't stop with the research, right? We're now, the research is great from a scale standpoint, equip everybody with the information, but it doesn't matter unless you're implementing it with the girls who need it. So we're busy doing that now.
And speaking of research, CJ, I know you've been working with, I think it's Colorado State University on a research project. Can you explain what that entails?
Yeah, it dovetails perfectly off what you were talking about. The first part of the research validates a lot of what currently exists in the field of connection to nature and what Allison referred to at the beginning. Nature has the benefits of connection to nature include attention restoration and also stress reduction. So nature also, it gives our executive brains a break, and it also gives us the capacity to recover from stressful situations a little bit faster. A lot of outdoor programs also show the benefit of opportunities for growth as a part of experiencing challenge in nature as well. One of the things that our research with Colorado State has shown is a little bit of what you were referring to. It besides the agreed upon benefits of connection to nature, the intention and the framing that we've been talking about a little bit, it gives folks the opportunity to shift perspective. And there are models and frameworks out there that talk about systems change, where structures, policies, and resources are the easiest things to move. They're the most visible things that we try and do. We create a new program. We try and give gear. We try and create opportunities for this visible change to happen. But the deepest and most longest lasting change happens when you shift the mental models of folks and communities. And by being intentional, by providing these opportunities, by rewriting the narrative that folks tell themselves and that we wrap around our communities and arts and nature and sports, we create an environment where people are able to write a new narrative about themselves. They're able to shift their perspective, and then they're able to go out and imprint that perspective onto the world. And so that's what our research is starting to show, the benefit of that intention in shifting perspectives.
Can you, Allison, can you talk a little bit about community cohesion as a kind of a social determinant of health and how these programs connect?
Yeah, and maybe just to back up for a minute and talk a little bit about, Rick, you mentioned some of the trends that we're seeing right now in funding mental health. And, I think when we think about mental health, the way it's a little bit different from funding other issue areas is that often when people think about funding mental health, they immediately think about funding a hospital, and setting up a program or something there. Or they may think about funding, academia to do research, and those are both good things. But one of the things that we're trying to do is shift funders' mentality. So it's another mental model shift to thinking about funding the entire, mental health continuum. So thinking about, health promotion and prevention, then thinking about early intervention, treatment, and recovery. And so, when we think about these, community models, it really is shifting, the models within the community, but thinking also about how we think about mental health, that it's not just in a clinical setting, although that's great, but we know that that really is reserved for maybe a specific part of the population that really does need, medium to high level support. Right? And that the majority of the public really may need, low to mid-level support with just, some basic mental health challenges. It could be around social connectedness and isolation. And so there are many other points of intervention where, philanthropy in particular can play a role in, in funding these programs. And, in particular, these programs have seen lots of funding cuts over the last decade, even in recent months. I know just, I have children that are involved in Scouts, nature, performing arts programs, all have seen funding cuts in the last few years. And so this is a unique opportunity for philanthropy to fill the gaps and really go in and help these programs to reach scale. We know that they work. There's research out there that that others have been doing, and that this is an important part of health promotion and prevention, and that by funding this. So this is a lot of the work that we do at Mindful, is educating funders on how to fund this full continuum, uplifting programs like Boys in the Wood and others that are in the room, so that funders know what those programs are that they can fund. And I'll tell you right now, there's a lot of programs out there. We don't need new programs. We don't need, new things to be started. What we actually need is funding to get to scale on these programs. There's efficacy, there's evidence, but we need philanthropy to really start scaling these programs so that they can, they can saturate the communities and they can follow the leadership of the communities who are saying, these are the things we need, because they're often culturally led programs from within our community.
Mm-hmm. Can I add to that?
Yes, please.
I think there's one of the funding is definitely a need. Do not clip this and make it seem like I'm saying funding is not necessary. But funding, everyone has their own superpower, or asset, or resource that you can provide to that. And so similarly to what you were saying, you were talking about people coming together and everyone having their own power and bringing that resource to the table to make sure that the whole community is now healthier. And so it might be funding, it might be connections, it literally might be, hey, you have this resource or you need this resource. It might be collaboration with like organizations like you mentioned, but I just want to emphasize that I think sometimes folks sit in a room and they say, oh, this is a call for funding, I don't have funding, I can't be of any use. And so that seems like a transactional relationship or call to action. But I think it's the idea that all of us have this piece that we can contribute. We're all part of the puzzle of what community health looks like.
Well, and I think to that point, CJ, that one of the things that we talk a lot about with philanthropy right now is this idea of community-initiated care. And so, no matter where you sit in a community, and based on that specific community, there is care that can be, experienced in those communities. So, for example, if you're a barber, if you're a clergy, if you're a coach, she was talking earlier about the coaches and equipping, through the Million Coaches Challenge, coaches everywhere to be a bridge to care and to support young people. So, no matter where you are in a community, there's ways that you can, volunteer your services, become equipped and trained to deliver various forms of care, various levels of care, in addition to the funding, and then being a connective tissue in the community between resources. And that's a lot of what Mindful does, is we're a connective tissue between the solutions that are out there, the funders, the experts, the researchers, but there's a role for everyone to play.
The Mindful Philanthropy published, I think, several now publications, I'm aware of 3 of them, on the strategic imperative for philanthropy and kind of what are the entry points. Can you talk about those publications? And we have, actually, there's a QR code, you'll see it, point that'll go to the resources page of your website.
Yeah, so a few years ago, we did some research with funders, and we wanted to understand why funding wasn't increasing to mental health. We heard a number of different barriers. Some of them were, we don't know who the other funders are in this space. It was an incredibly fragmented space. And part of that is because a lot of the funding going to mental health is place-based, meaning that it's hyper-local. And so people didn't know what what others were doing. One of the things that we heard was that there's a lack of leadership in this space. Because it is so local, we don't see funders rising to create models that we can follow and leadership we can follow. But the biggest, one of the other things that we heard was that we don't know what to fund. Where can our dollar go the furthest? And so we released, as Rick said, a strategic roadmap. It's actually a part of a series of 4 called Mental Health at the Center. We're releasing our 4th piece on it this fall. But the strategic roadmap highlights 5 key areas of investment. So the first is community. So thinking about what does a community need? What are the community infrastructure and programs that are culturally led within a community that need to be uplifted? And so this is combating social isolation, promoting connectedness, helping more on that health promotion and prevention, thinking about the community-initiated care that we just talked about. The second is youth and their support systems, and this is really important for the conversation that we're having today, because a lot of the conversation around the youth mental health crisis is focused on the youth themselves, and yet we know that one of the single most contributing factors to a youth's well-being is actually a relationship with an adult that's healthy and positive. And so thinking about the entire ecosystem that's around a youth, whether it's caregivers, it's educators, it's coaches, that are in their lives and pouring into them. So third is workforce. We know that we do not have enough workers to treat ourselves out of the crisis. We're thinking about alternative forms of workforce. We're thinking about different reimbursement models through policy efforts to pay people for the efforts that are in, whether it's community-initiated care and other things. But workforce is really important. The other one is crisis. And this is actually, in a lot of our survey work, we found that this was actually the thing that funders did not want to fund because it required a ton of convening work, of connecting the dots. It was hyper-local. Every single area code was different as it related to the different infrastructure needed to treat crisis, but primarily thinking about, how does someone have someone to call, someone to respond to them, and then somewhere to go when they are in a moment of crisis. And then lastly, this is what we call implementing what works. So these are what I mentioned earlier. We know what the solutions are for mental health and well-being, but we need to fund them at scale. There is not enough funding to the initiatives that are out there. There are brilliant people doing this work, and I'm looking around and seeing some of them in the audience, and they need funding. It's why we called for increased levels of funding, hoping that mental health funding would reach $35 billion annually by 2035. So it's a pretty bold call to action, but we're confident that philanthropy can get there.
And Vanessa, the Coalitions for Sports Equity, I know set up a fund for sport equity, which I think the target is $30 million, right?
Yes.
Can you talk about what the goal of that fund is?
Yeah, I think it's, it's what I was sharing earlier. We want to make sure that we're getting to 25 states, if more better, more is more, and really trying to change it from a place of scarcity to really bringing everybody together to unite and advocate for youth. But I did want to touch a little bit on what you were just sharing, Allison. I think on the crisis piece, people often think about crisis as like that is you've hit the rock bottom. And what we've learned from Crisis Text Line is, one of the organizations we funded is that there are many parts to crisis, and it's actually earlier in whatever situation you can be, and the impact that you can have even before it starts to really manifest is enormous. And we shouldn't be shy about that. You can really change one person's life, and we've already talked about what a difference individuals make. We focus on coaches, and coaches are sometimes the only consistent adult in a young kid's life, or in many kids' lives, and yet you can't assume that you know how to coach. Like most of the most coaches out there are volunteer coaches who have gotten probably no training, are doing this out of the kindness of their heart, and have a lot of different responsibilities. But there is such a thing as what it means to be a good coach and what quality coaching looks like as well. So just many opportunities there.
There's a kind of rubric Allison and I were talking about. I tend to think about it as concentric circles, where the outer ring are, we'll talk about it in terms of kids. Kids are fine. These are kids who just are happy-go-lucky. I don't mean to say it that way, because everyone struggles in some way or another. Then there are kids who are really finding challenges, managing stress, managing life, family, and that's where I think concepts of like training in social emotional learning and perhaps training mentors in trauma-informed care. There are populations then that have significant risk factors, and that's where specific interventions are needed. And then there are people who are in crisis. Each of those takes different approaches, and there are different entry points, different goals, but it's a way to kind of think about sort of not just sort of the crisis, but also sort of protective factors and support structures going through that.
Yeah, absolutely. It's what I was also, if you're in an education system, we refer to this as the multi-tiered systems of support. There's the coincentric models, circles as well. And, I think all of these different things that we're talking about today, and, arts in particular, are ways that it can affect individuals, whether they're in high need or, kind of moderate need or low need. But it also, one of the things we haven't maybe talked a lot about is the way that it impacts, community level. And, that we know that communities where they're engaging in, arts and nature and sports, that they're more connected. They experience, so for people that go to performing arts several times a week or even once a week, that they experience more connectedness to other people in their community. And so, yes, these are individual, whether it's high need or low need and in the individual interventions, but, we're talking about really levers, so to speak, that we can pull on to really transform our society. And that's what's important, in that, these have honestly become, we've thought of these as like nice to haves in our society over the last decade, but these are not nice to have things. These are strategic levers for how we experience holistic health and community healing. And it really is time for that shift, that model to shift in how we think about these things.
Yeah, I think some of it is what continually comes to mind is that it's a restoring of connection. Vanessa, your work is talking about restoring of connection to your body as an athlete, to life as a sport. Art is, I don't know a lot of art that exists that is this individual endeavor, and even our connections to nature are sometimes have been separated by living in built environment and by other factors. But this restoring of connection, this restoring of community is the first foundation of health, as you talked about. And so it's just a reminder that the more we continue to like return, we're not doing something new as much as we're taking a stock of the systems and resources we have now to figure out how we return to the way our ancestors lived and lived well in connection with land and with each other.
If I can add to that as well, connection, trust, and belonging.
Yes, yes.
Right? I think that more and more we know about the communities out there in the world and less about the neighborhoods and the people on the streets that we live on. And that, everything that we've described here gives an opportunity to create that connection, build the trust, and over time also feel like you belong. And what's both simultaneously sad and great about this is that this is a manageable, we can address this. This is, there are huge, enormous problems in the world, and this is one of them, but this is a solvable challenge. Yeah, so, yeah.
But it does take money, it takes commitment, it takes speed. So I wouldn't diminish the need for money. Of course, I work at a foundation, but...
Yeah, neither would I.
None of us up here will.
But we have a few minutes for Q&A. So if we can turn to some audience members, I see right up front. A hand went right up. But we do need the microphone, so if people can wait for the mic runners.
God bless the mic runners. God bless you. There's a lot of performance in the four of you. And Vanessa, you started us off by saying, look at life as sport, and then you asked us to hang on to that idea. Do you each have coaches yourself? How are you coached, and what would be your advice as to how to be coachable?
What a great question.
I feel like this starts a whole new panel.
Yeah. So, we also I believe there's a coach inside every single one of us, right? And so we'll start there. And also, the most important conversation that any one of us has are the conversations that we have with ourselves. So if you haven't identified that coach inside of you, maybe right now decide that little voice, you can change it from judge and jury and all those other roles that it seems to play, and just actually designated on being a coach. Now, there are also some really specifics. We have a ton of resources in different areas, nike.com/coaching. It's free, it's available for everybody, easy to download, etc. And then there is, I am coached by my team. I have witnesses here. I think there's a question around, like, are you willing to be coachable? Yes. It is an ongoing life commitment. It's not like you ever stop or end, and you're constantly evolving and learning in that space. And also, whether we like it or not, I think it's also true that the way that we live our lives, you are role modeling whether you want to be a role model or not. And you can either be an example of what is possible, or you can be a warning as to what not to do. And I think that is really bundled up in the realm of coaching. I have a soon-to-be 12-year-old niece who I love and adore. I have many nieces and nephews who I love and adore, so I just need to be on the record saying that, because it is true. But her birthday's coming up, so she's top of mind, and one of the gifts for her is a volleyball session she's really looking forward to. And just a few weeks ago, we were at one of her tournaments, and the coach was not doing a great job. And you could tell immediately. One, you could tell what was happening on her court versus what was happening everywhere else, but the girls were already on the side talking about how they wanted to give up. And she walked over to me and said, like, everything that's happening is really unfair. I'm not doing this anymore. And it's like, okay, well, I'm going to be your coach right now. That's not going to happen. And then you have to get in there, right? You don't know when these moments are going to come up for you. You don't have to look for them. Sometimes they find you. And then that moment, you can be a coach to her, and also you can be a coach to the coach, and oftentimes they don't always know, how they're being perceived or what kind of impact that they're having. And just because they have that title, just like in everything else in life, does not mean that they have the training or the understanding of what's necessary. So that was a very long answer.
So in the interest of time, I do want to get to some other questions. But do either of you have sort of a burning answer to Chris's question?
It's like 15 seconds. I think being open to being coached and coaching, similar to what you said about relationships, community, trust, all of this is a matter of practice and repetition. You can know, you can be aware, but if you don't repeat and practice and iterate, it's not something that becomes a part of you and a part of your practice. So it's repetitions in being open, even when you slip and fall, and repetitions in coaching when you see those opportunities to support someone else.
I would just add to that, because I was going to say my team who's sitting here too, and I had just asked them for feedback from something I did earlier this morning, but I think, probably 25 years ago, I was terrified of public speaking. I mean, terrified. But I made a commitment to myself, and I think this is the honest conversation you were talking about, that I would always say yes. I would be willing to risk. And I think that's an important part of coaching yourself and coaching others, is being willing to hold yourself and others to the potential that you have. So being willing to take the risk and then be a learner, always asking for feedback. You're never beyond getting the feedback that you need. We all need it.
A couple of other questions. Who raised their hand?
It's in the
There's
back.
one here in
Back towards the back.
Yeah, we're so close.
We might just need people to stand up.
Yeah, and feel free to stand up when you ask, just in case it's hard for people to see you.
Hi, I'm Quinny. I'm from Durham, North Carolina. And similar to CJ, I lead a community-based organization that promotes cultural healing, collective care, and also strives to push people towards civic engagement. One of the things that I've observed being new to this space is communities know what they need. I think that's been true since the beginning of time. However, finding those opportunities for people to fund us continues to feel like the obstacle. So what are some ways that y'all are making it possible for people to find you? And I think one thing that I grow concerned about is I don't like this sense of organizations that are providing community care to feel this sense of competition with each other. That breaks those ecosystems down. We need to work together. So how are you funding these types of programs in a way that helps support their ecosystem?
Yeah, I mean, I can jump in. I think you pointed out a couple of really great factors and challenges that are facing really community-based programs. And so a few years ago, we did a survey and spent a ton of time with focus groups of, really hyper-local interventions, organizations that were budgets under, 100,000, 150,000, and just listen to them. So one of the ways that we're doing this is we've uplifted kind of rubrics for funders and how they think about culturally led programs, because many times those organizations do not have the data that funders are looking for. And so there's a mismatch in expectations. So we educate funders and how to be a good partner with them, but to get in the trenches and maybe fund the data collection that those organizations need. But then on the flip side of that, we're helping the funders to think about what are the questions to ask these organizations. How do, rather than asking for data, how can you get to know them and be a partner with them? And what are the things that, rather than evaluating them on data, evaluate them on this different type of framework and rubric for, culturally led programs. And then we do look for coalitions, that the organizations that are coming together around similar outcomes, but they're leveraging their different assets to get to those outcomes. And I think we are stronger together. We can run, much faster when we go alone, but our impact is going to be much less. And so, where are the organizations that are coming together? It makes it, it's actually an easy sell to funders when, those nonprofits are coming together and they formed a coalition. And then one of the things we're doing is we have a commitment to uplift those organizations. We early on in 2020, we uplifted the Confess Project to a number of funders when they were under $150,000. It enabled that organization to scale. They're now kind of a leader in the industry. The same with Boys in the Wood and CJ's work. And so we're always out there uplifting those organizations as we become aware of them. But you're mentioning some of the challenges that are out there.
One thing, I'm not giving away any money, so I can't answer from that perspective. But one of the things, the calls to action I might say for philanthropy is to invest in the weavers and connectors and the translators who are in community. You all might look for organizations, but you might not know the places to look as well. And so I've been involved. I've done some work with a different hat on with a couple of foundations where I literally spend my time going through the people I know who are doing the work on the ground, and I translate the work they're doing into spaces where they're not represented. And that is a key community role where that's a part of the ecosystem that enables all of these folks to be supported.
We are out of time, but we'll be around for afterwards. And my staff has a bunch of these reports. It's called The Role of Arts in Healthcare, Transforming Lives and Creating Community. And so we're glad to share those with you. I think you'll be struck by some of the ideas. And just if those of you who are funders in any way, shape, or form, think about what interests you. And maybe it's the arts, maybe it's nature, maybe it's sports. Think about that intersection. How can that be sort of greater than the sum of the parts? Like, we support the Arts and Medicine program at New York City Health and Hospitals. You know how many people support hospitals and how many people support the arts? They didn't know about these intersections and how much of a difference it makes, particularly to the frontline staff in those hospitals.
Yeah, absolutely.
So.
Thank you, Rick.
Thank you, everybody.
Thank you.